which lectern do you want to use? That one. So walk straight across, past this lectern onto that one. Okay.
Welcome back, everyone. If I could urge you to, as quickly as possible, fill your seats and make sure that you are comfortable ahead of our next session. Fantastic. Thank you all very much. I know that we are rushing you between different bits of the conference, trying to pack a lot in, as I said earlier. So I am delighted to welcome you to this session, our keynote political speech of the day. And to some people, the National Health Service is the antithesis of some of the things that we're talking about today. For all that we love about the NHS is also, there's no escaping the fact, the NHS is a large national bureaucracy. It is controlled mostly from Whitehall or London, and it perhaps doesn't always have the level of accountability or responsibility or responsiveness to patients and families that we might always want and respect. But it's also true that health and the NHS as an institution is fundamental to restitching our social fabric, as I know our next speaker is going to talk about. We know that those communities that are most frayed are also those that suffer the worst health inequalities. We know that one of the most tragic symptoms of our fraying social fabric is what Angus Deaton and Diane Case call deaths of despair, those taking their own lives from suicide or dying from alcoholism and drug abuse, most pertinently in the United States, but also not something we escape from here. And we know, as we found during the last 2 years, that the NHS is an institution that relies immeasurably on the voluntary action of all of us, whether as pandemic responders, volunteer vaccinators, or simply the preventative power of civic society. It is only a small stretch, I think, to say that one of the greatest public health interventions of the last few decades was the establishment of Parkrun. So health and community are intimately linked. And I'm delighted today to welcome a speaker who has thought about this, I think, more than many, if not all, of his predecessors, the Health and Social Care Secretary, Right Honourable Sajid Javid, MP. Sajid is someone who I think understands this more than others because he has lived a number of different lives in Whitehall. He has been the Communities and Local Government Secretary, he has been the Business Secretary, he has been the Home Secretary, and of course he has also been the Chancellor of the Exchequer. He knows this subject from multiple directions and therefore has a fierce appreciation of its complexities, but also some of the simple truths. So I am delighted to welcome to the stage, and without further ado, the Right Honourable Sajid Javid, MP.
Thank you, Will. Now, many years have passed since Edmund Burke wrote about the little platoon that we belong to in society. His timeless insight was about the importance of the intermediary institutions that sit between the individual and the state to our well-being as people and to our prosperity as a nation. Burke was mostly referring to the value of historic institutions, but today our platoons are of course, much more varied. They encompass family and faith groups, community networks, charities, and so much more. I believe in a small but empowering state, one that can make room for and enable thriving markets, strong families, flourishing communities, and individual freedom. These are the drivers of all kinds of capital: physical, financial, human, institutional, social. And it's this capital that I think creates happy, healthy, and wealthy societies. But whilst financial capital and physical capital are both easier to measure and manage, when it comes to other kinds of capital, that task is, of course, much harder. And that is why I think Onward's work to quantify them is so essential, and it's brilliant to be able to join you today at this conference. Your report that you did on the state of social fabric was an important publication that is already shaping the thinking of government. And I hope that you saw how it was referenced to, for example, in the Levelling Up white paper. This is a subject that I deeply care about, both personally and politically. I was born in Rochdale, a town that many of you will know was the birthplace of the cooperative movement in the 1840s. But now it sits at the bottom fifth of Onward's social fabric index. Now, the Rochdale I remember was a vibrant community where people looked out for and looked after each other. I have wonderful memories of my time from living there, and we cannot turn back our backs on the communities like these and to allow the potential to go unfulfilled. I've also been fortunate enough to live in different cultures and communities across the world, including in New York during the resurgence in the 1990s, and later on in Singapore, which sits near the top of the table for almost all global metrics of progress and happiness. The common thread that runs through all these experiences, here and abroad, is the importance of social, human, and institutional capital to an area's happiness and prosperity. Today, the Conservative Party faces some profound questions. Is it possible to reconcile levelling up and the need to strengthen community in places like Rochdale with higher national economic growth and an instinctive opposition to overmighty government? Can we show that we have delivered on our promises before the next election, but also make the reforms that we know are needed to address the long-term generational challenges that we face? And can we help with the cost of living now, whilst also building resilience against future shocks? If we back radical economic scientific progress, bust open cartels in the private and the public sector, and put more power and control in the hands of people, families, and communities, I know that we can grow all forms of capital. Then the answer to all these questions, it must be a resounding yes. But of course, there's a lot to do. And as the Secretary of State for Health and Social Care, I've had the responsibility of steering this country through the COVID pandemic. In some areas, the damage the pandemic has caused to our communities, to our health, to our public services, it will take years to recover. In other ways, though, we have seen a glimpse of the future and the exciting possibilities that if we back innovators and what can happen if we do that when our communities come together. I was so moved by the volunteers who were the backbone of this country's vaccination program, the mutual aid groups that sprang up in local communities to support those that were shielding those that were at the greatest risk, and all the other little platoons that bolstered our national response at a time when it was needed most. Now we must summon the same spirit to address the stark disparities that the pandemic has unveiled. The experience of this pandemic has been like a receding tide, exposing the underlying health of our nation. It revealed some fractures, and in many cases, of course, it deepened them. We know that some communities experienced disproportionate levels of devastation from COVID, and that we asked huge amounts of some groups, like the young people that were hit with huge mental health challenges, deeply impacted. And among those that were smoking or had high obesity rates, we saw a worrying surge in complicated COVID cases. The burden of ill health is not evenly spread in our country. People living in the most deprived areas of England live in good health for around 19 years fewer than those in the most affluent areas. 19 years fewer. And in some communities, life expectancy is actually in decline. This is, of course, completely unjustifiable. And the Conservative mission is to right these wrongs and to reduce these disparities. Because economic freedom and public health are eternally intertwined. In years gone by, major improvements in health have led to a profound social and economic progress. Think of Edward Jenner, John Snow. Think of the Public Health Act in 1875. And now we need some seismic shifts in how we do health policy, not just for the health of the nation, but for the strength of our communities, and to create the conditions for much faster economic growth. It was no coincidence that my first major keynote speech as Secretary of State was delivered in Blackpool. It's a town where over 40% of the people who are unemployed due to ill health, almost double the average of Great Britain. It's a stark example of how an area's health and wealth are closely connected. I used the opportunity to set out my mission to end the disease of disparity, and one of my first decisions as Secretary of State was to give this a new focus and a new name to what was then known as the Office for Health Promotion. So I created OHID, the Office for Health Improvement and Disparities. And this is not just a rebadging exercise, but it's a sense of the renewed mission that exists in my department and government to make sure that everyone has the chance to live a healthy life regardless of their background. OHID launched at the end of last year, at the end of this year, and it has already provided a vital asset, bringing together the best public health expertise to drive this important work. This includes our Health Disparities White Paper, which we will be publishing shortly. This white paper will contain our plans across a wide range of areas, including on reducing obesity, tackling addictions, and to help people stop smoking. This will, of course, help everyone, no matter where they live or where they come from. But these threats to our health also contain profound disparities that can cast a shadow over local communities. For instance, the smoking rate in Blackpool is almost 20%, compared with just 6% in Richmond, London. Through thwarting the downward spiral of poor health, we can give a shot in the arm to the communities who feel that they have been left behind and bring opportunities where they are needed most. The white paper will also tackle a host of other issues that I believe have been neglected for far too long, from sickle cell disease to a lack of doctors in deprived communities. It will make clear that addressing disparities is everyone's business and set out tangible actions for all of us to take, including government, with private enterprise and frontline innovators working closely with us in partnership. Local communities will be at the center of this approach because so many of the factors that sit behind our health come from the areas that we live in. So I will give local areas more powers to support to address disparities in their areas. This is a multi-billion-pound economic opportunity to unlock greater productivity by tackling disparities, and it's an opportunity that we must seize. This prevention agenda is one of the most powerful solutions that we can possess. One of the central tenets of conservatism is that we can generate the most value through our relationships with one another, rather than solely through our relationship with government. Through giving people the tools that they need to manage their own health, we can reduce the demand on the state, preventing them from joining the waiting list that we're working so hard to bring down, and ultimately giving them more freedom and opportunity, not less. The burden of just one preventable disease cardiovascular disease. It costs society, we estimate, around £18 billion a year. Although we've invested record sums in the NHS, we can't keep pumping in more and more money while we continue to go down the same path of poorer health. 2 months ago, I made a speech setting out how we will prioritise prevention and put the full weight of the NHS behind this goal. I pledged, for example, that we will build more and more community diagnostic centres. Those are the one-stop shops that sit right in the heart of a community, helping people to get diagnosed earlier and closer to home. I visited one of these CDCs in Poole recently, and I was greeted by smiling volunteers at the door. And I heard from local people about how they no longer have to travel miles just for a test, but they can just pop in to the local department store and their local high street instead. I also set out how we will task integrated care systems with creating plans to reduce the major preventable diseases, and how we will take the NHS app, which is now in the pockets of over half of the adults in England, and turn it into a portal to get personalised advice on your health. And all of this I've just mentioned, this is just the start. In the matter of just a few years, patients will be able to benefit from personalised dietary advice and exercise routines. Robots will be doing much more surgery under the supervision of humans so that we can treat more and more people and save more lives. We'll have mass genomic sequencing, which will mean that we can preempt more and more disease, and a finger prick test that will help us to catch cancers much sooner. My plans for healthcare reform will bring the future forward, improving the health of the nation and reducing the disparities that we've all seen. I've talked a lot today about how we can use health to transform our communities, but we must use our communities to transform healthcare too. The pandemic and the strain of the restrictions that were put in place showed how so much of our physical and mental health depends on the relationships that we have with each other. And now that we are living with COVID, we've been able to restore some of these experiences so that people everywhere have a new appreciation of these connections, which will give us a great platform to build on them when it comes to things like social prescribing. Social prescribing has been one of the most promising developments in healthcare for many, many years, where patients are put in touch with link volunteers, link workers, who then connect them with the arts and social activities that can have a great impact on their sense of well-being. Just a few weeks ago, I went to a roundtable that was hosted by the National Academy for Social Prescribing. And I heard, for example, about a new initiative called Art by Post, where people at the risk of social isolation are sent art activities that they can do at home. And I also heard about the Green Social Prescribing Project, where outdoor activities like walking schemes are offered to patients to improve their mental health. I know that Onward has welcomed this work, and I see it as crucial to the future of personalised care, while at the same time reducing pressure on the NHS. There have now been almost 1 million referrals to social prescribing services in this country, and we now have some 2,000 social prescribing workers in place. But I want to see this expand even further. So I've set the NHS a new target of 4 million people getting personalised care by March 2024. Another example of personalised care is the Shared Lives programme, where people in the need of social care go to live with carers and become like any other member of the family. Think of it like fostering, but for adults. I've heard wonderful stories of people living together for decades. At this point in time, some 9,000 people in England are supported in this way. And I want to see this this model, this ambitious model, being expanded, making it available to people right across the country. We can also use the health and care system itself to connect people with the communities they live in. Onward has written compellingly about the decline in community participation over the past few decades. However, the pandemic has bucked this trend, as scores of people, they stepped up to support the country's vaccination program. They protected their neighbors in vaccination centers, hosted in churches and clubs and cricket grounds, and right in the heart of their local communities. This experience showed that there are huge benefits on offer when you can create the right conditions for people to come forward. And just as we're learning from the successes in developing and procuring new vaccines and treatments, we must take forward this community-centered approach and apply it to other routine vaccinations wherever possible. We must also make sure that we don't lose the momentum and the energy that we have seen around community participation. During the pandemic, hundreds of thousands of extra volunteers, they stepped forward to help the NHS, including over 400,000 people that came forward to join the NHS Volunteer Responders Programme. I've decided to keep this programme, and I want to use it to support the current challenges we face in health and care. This country's health and care system touches all of our lives. It's there from our first moments to our final breath. I want to use this to reach to connect with people in their local community, to benefit them and the places where they live. Our collective experience of COVID has taught us a huge amount about ourselves and about our country. It's shown us the value of the social fabric that binds us, and that there are some areas where it is severely under strain. We cannot just patch things up and hope for the best. We must use what I think is a unique moment in history as an opportunity to determine what kind of society we want to be and reject the slide towards social isolationism. The ties that bind us are too important to allow them to decay. So let's show our commitment to restoring what gives us such hope and happiness. And there's no better way to do this than by transforming the nation's health. Thank you all very much.
Well, Sajid, thank you so much for that. And that touched on so many of the themes that we've been discussing over the past few hours in this conference. And it's fantastic for you to take a social fabric approach to health and social care, long overdue and much needed. I'm going to start by abusing the position of the chair, and then I'm going to bring in some questions from the audience. And I wanted to start where you began, which was Edmund Burke. You've talked in the past about having a kind of Burkean reverence for institutions, both with respect to the power of institutions to bring us together, which we've talked about a lot today, but also the kind of formative role of institutions to shape our values, our behaviours, our norms. And obviously there is, at the same time, the very Burkean idea that in order to preserve institutions, we need to reform them, that you cannot stand still. You need to constantly refine and reform the institutions that bind us. I wonder, what do you think Edmund Burke would have made of today's NHS? And if he were you, if he were the Health and Social Care Secretary, what reforms would he be pursuing, do you think?
You start with the easy question.
Yeah.
Okay. I'd like to think he would be impressed by what our society has created when it comes to the NHS as an institution, an institution that is compassionate, that is there, free at the point of use for all of us at our greatest times of need. But I also would like to think he'd be critical as well, a constructive friend, let's say, where he'd recognise, as I've just talked about, that it's far from perfect. There's a huge number of challenges, and in that, maybe he'd think that there's a role also for more volunteering for the family. That the default option shouldn't be the state. Obviously our society is full of challenges and problems, and I think he was someone that don't always look to the state. Think about yourself, and certainly as communities, what you can do. And then linked to that, I think that he might think that some of the reforms, either that some of the kind of things I've set out today, what I've talked about recently in a speech I did recently to the health sector, some of those changes, he would support them, especially where they're backing innovation, not just community groups, but I think he's someone who really saw the value of innovation and innovators. If I can, I'd also say it's not all about Burke. I mean, I do value what he taught us, but it's about Disraeli, about having one nation and recognizing that when it comes, I've talked about health disparities today, and I think that example I've just given between smoking rates, for example, between Blackpool and Richmond, London. I mean, in our own country, just a few hundred miles apart, the difference in how we've got to work harder to create that one nation. And also, if you think about Margaret Thatcher and how she was someone that was someone who didn't want to ignore the big problems in society and see them get worse and get on with the job, and also someone I think that supported the idea of devolving power where you can, including in big institutions like the NHS, to local communities, local areas. And that's what the ICSs I mentioned about earlier, the 44 ICS, that's what they're all about.
Yeah, fantastic. And actually, just reflecting on what you just said, there is quite a lot in what you described as the disease of disparity that you can trace a direct line back to Disraeli's two nations, one rich, one poor, and the disparities between them. I want to touch on one of the other things you mentioned. So you talked a little bit about the NHS Volunteer Responders Programme, the phenomenal outpouring of support and energy and time that people gave during the pandemic. It kind of completely blew people away. But one of the characteristics of that was also that the system found it quite difficult to cope with that. I mean, 750,000 people put themselves forward. I think in the end, only around 140,000, which is still obviously a huge number of people ended up doing doing shifts. And I've always kind of grappled with this question of whether or not we're making the most of the latent potential within society. That there is a lot of support out there and willingness to come forward and do things, but the state doesn't always kind of pull it towards itself and make best use of it. How can we best capture and sustain some of that civic energy over time?
Yeah, look, I think volunteering is great, and I've given some examples of that in health. I think the state has an enabling role in that. And as you mentioned, with the pandemic, with the responders program, 400,000 people coming forward. I was one of those 400,000. I registered and volunteered. At that time, I was on the back benches, found I had a bit more time on my hands than I had expected, and so I volunteered. My children did, and that is something that a program that, as we learn to live with COVID, you sort of think naturally come to an end. But actually, after talking to the NHS about it, and actually some of the people that were involved, and trying to sort of sound out some of the volunteers, we decided to keep that program. The other program, actually, we are expanding nationally. We did a pilot of NHS reservists. It's a national NHS reserve. So these are clinicians that have retired, and many of them came forward during the pandemic, and many of them said, I'd love to continue helping. Of course, the NHS still has many challenges, and we piloted that program, and we are now decided to not only sort of expand it, but make it national. So we're rolling that out, we've launched it, it's being rolled out nationally. And then also when it comes to volunteers in health, I think we can't also forget the role and the importance of the pre-existing voluntary groups and how they've stepped up, expanded, and many of them will continue to play a role. So I'm thinking about Age UK, for example, and St John's Ambulance in particular, with the vaccination centres. 26,000 volunteers. My wife was one of them. And we met the people that came trained up in many cases, and they want to still keep helping. So that's why I mentioned earlier, we're actually behind some of our other vaccination programs. Think about the vaccinations we would normally do in school during school time. Many of them were behind because kids weren't in school in the normal way. And now we're looking at how we can use some of these volunteers because they want to help to actually help us with our vaccine sort of catch-up program.
Terrific, fantastic. I'm going to now take questions from the audience. I do have more questions myself, but I'm conscious of your time and the need to bring in.
Javid, I would like to know, why is someone who's concerned with public health that you do not speak about the climate crisis, and why do you back fossil fuel investment and new fossil fuel licenses when surely the climate crisis will be the greatest threat to public health?
Thank you very much. Thank you very much. Thank you very much. I'm going to take a number of different questions. So if anyone else would like to ask a question as well, we have a question here. Can we bring a microphone to this gentleman here? I will let you come back on that if you would like to.
Thanks, yeah. I'm not a protester. Yeah, hello.
Do you want to stand on your chair? No, I'm just kidding.
What's it? Yeah, I'm a Paul Dinsdale, health writer and editor. I just wondered if you could say a bit about the new integrated care systems and what will they be able to achieve that CCGs haven't been able to achieve, and how much scope will there be for local authorities to work with them, given that they're often very separate organisations. Yeah. Thanks.
Fantastic.
Yeah, thank you. Just for everyone's benefit, obviously, so you know about the integrated care system, but those are the sort of regional bodies that we've created. Many of them sort of existed in some form before, but through the new Health and Social Care Act, which has just got through Parliament, they've been created on a statutory basis, and they are responsible overall for running health and care, especially care services in their region. There's 44 of them across England. What will be different from approaches before is that in terms of their responsibilities, first, they're just much broader. So they're not just responsible for, let's say, primary care or acute care and stuff. They have all health responsibilities. Second is that their membership reflects that, but it also has a broader membership of, for example, local authorities, representations from pharmacies and others and things will be represented on their boards. Is much more of a partnership approach. And then the third thing is I think they will ultimately be much better for integration of social care and healthcare. There's an obvious link. And the importance of working together between those two parts of my department, healthcare and social care, is never been more important than it is now in terms of, for example, we have a lot of delayed discharges in hospitals where people are clinically discharged, and typically older people that there's no domiciliary care available for them or residential care because lots of reasons, but one of the reasons is not enough joined up services in the local area. So I think it will help with that particular problem. That's why I published an integration white paper on that recently, just setting that out. And if I can, I know the gentleman's gone, and to be fair to him, he should wait till his turn, but their question itself was a perfectly good question, I thought. I don't know why he didn't just stick his hand up and ask the question, but and it is, when it comes to healthcare, clearly, climate change and tackling climate change is of huge importance. And I just came from the G7 meeting of health ministers in Berlin a few days ago, and it was we only had a whole day of discussions, and it was one of the key areas of discussion that we had, and so the action that we're taking, including, I was pleased to tell my G7 counterparts, we're the first country in the world that has legislated for our health system to be net zero. None of our counterparts have done that. We've done that because we recognise the challenges.
Absolutely. And I should also say that if people would like to hear more about sustainable communities and the way environmentalism feeds into this debate, you can come to Halifax on Friday because we're talking about it there on day 2 of Restitch. Would people like to put up their hands? I've got one in the front row, if that's the only one, so come down here. Thank you very much, and I'm going to ask my question then.
Thank you very much. Thanks. Mr. Javid, Ben Wright from the BBC. A couple of questions, if I can. All communities are seeing a shortage of GPs at the moment, and that's having a huge impact on the service people are getting. What is your plan for returning staffing levels to something approaching what they were? Or do people have to accept that the contact they used to have with GPs has now gone for good? And a second one, please, on parties. Panorama tonight have got more evidence of rule breaking and drinking in Downing Street. You'll have seen the picture from ITV yesterday about the party in November 2020. As Health Secretary, what do you think about that picture? And are you fed up having to defend what happened?
No, thank you. Let me start with GPs. I think everyone understands why we couldn't have the sort of regular GP service during the height of the pandemic. I think we all get that. I think people also understand that as we now are learning to live with COVID, how things are returning rapidly, but it's still taking time. Not least because, for example, many people stayed away from GPs, they stayed away from the health service generally. They knew the health service was trying to cope with the medical emergency, either in hospitals. Many GPs had to go into vaccination duty, particularly in care homes, and everyone understood that. So, I mean, the good news is things are returning rapidly, including face-to-face appointments that I think are vital and should be a choice for people. And we were right, I think, over the winter to support with record amounts of funding with what's called the Winter Access Fund. And then obviously Omicron came along, which meant that the recovery took longer than anticipated. But the last part, I think, of your GP question was, do we have to get used to some kind of permanent change in service? No, absolutely not. The GP service is rapidly recovering. I think there are some reforms we need to make in primary care. I'll have more to say about that later. I think we can learn from the pandemic and make some improvements. But I think our GPs across the country have worked incredibly hard, and they continue to do so. They need the support of government, which they have, but services, I think people can absolutely expect to have what you might refer to as a normal, regular service once again. On your second question about parties, look, I've been very clear about my views on this, throughout this whole saga, and right from when the first pictures appeared, and yesterday we saw new pictures. I'm sure the Prime Minister and others will respond to that. I don't know when the Sugray report is coming out, but I understand it's imminent, and when that happens, I'm sure the Prime Minister will respond to that. As for the sort of the policing part of all this, the police have a hugely important role to play, but it's independent roles, operationally independent, and I shouldn't comment on that.
Fantastic. Thank you very much. We have a few more questions. So I'm going to take this gentleman down here at the front. And if I could say, notwithstanding Ben's question about parties, if we could try and keep questions on the matters at hand from now on, that would be great.
That's great. Thank you. I'm Tony Lopez. I worked for 29 years in the NHS. I'm not here in that capacity, but I haven't got any questions about Partygate. But I do want to just take you up on the question about the GP, so I'm glad you came to me next. Because the problem with the GP services predates the pandemic. It was already under enormous stress. And I think it's disingenuous, perhaps unintentionally, to suggest that the pandemic has been the problem with GP services. That's not really the case. GPs are hanging all around the country, and in places like my nearest town is Plymouth, many patients can't find a GP at all because the service is just, it's in crisis. So I think it's disingenuous to suggest that as the pandemic recedes, everything will go back to some ideal. I'm not sure that can be true.
Do you want to come back?
Yeah, thank you. And I agree with you about there was a problem in primary care long before the pandemic. I absolutely accept that, and I think the government has accepted that. You'll recall that before the pandemic, the government had made a commitment, for example, on the workforce, on primary care workforce, including GPs, and that commitment was made precisely recognising that there's a problem, and they're recognising what I think is certainly the central problem before the pandemic, which was the lack of workforce. And that expansion of the workforce continues. It can't be fixed overnight. But also, when I mentioned earlier to the earlier question about reform, I think as a society we also need to think about how can we improve primary services more generally, not just the GP bit of it, primary services more generally. There are other health professionals that are primary care professionals. Can we make more use of that and easier access to those professionals? Can we make more use of our pharmacists, for example, like many other countries have, including the UK? In Scotland, for example, pharmacists play a slightly different role, especially when it comes to primary care. So these are the kind of things we need to think about. But I'm not arguing with your central point. There was a problem before the pandemic as well, of course.
Fantastic. Can I end? I realise there's some more questions, but I'm going to end with one question, just because it brings us back to something that we talked about earlier, which is, so Michael Sandel, in his remarks earlier, talked a little bit about the fact that we valorize some people in society, those with cognitive ability, and we not quite denigrate, but we don't pay respect to those who fulfill other roles. David Goodhart has also written about this, particularly those with caring responsibilities or indeed vocational skills more generally. I wonder, what do you think you can do as Secretary of State, or the government more broadly, to change that culture and to pay greater heed and respect and love and care for those who care for us? And how much is that a big part of what you're trying to do in your role?
I think it's an important point. Let me take social care example. That we need to make sure that people in social care are getting paid properly. Right? Do fantastic work. We've got a big shortage of people. Why have we got a big shortage? I think that pay is a big part of the challenge. And it's right that the level of state funding towards social care, although it's a mixed economy, social and private, public and private, but the level of state funding is at the highest level ever. The levy that we recently announced, over 5 billion of that goes to social care to make some of the changes. Also, I think when it comes to social care, we need better recognition of what I certainly recognise, but I don't think in wider society it's a bit different, is that these are very skilled people doing an incredibly important job, and we need to find better ways to recognise that. So in the funding that I've allocated over the next 3 years, for the first time we set aside £500 million to work with the workforce on recognition, on training programs, on basically the ideas that they're giving us from the sector on how we can basically try and help address this challenge you identify.
Fantastic. I'm afraid, I realise there are other people that want to come in, and I apologise that we've run out of time, but thank you all for your brilliant questions, and thank you so much to the Secretary of State for joining us. Can you join me in giving him a round of applause before we move on to the next?
Thank you to the Secretary of State, and thank you, Will. We've now got a short break, and I would urge, yes, brilliant. I would urge you just to do two things. One, do you remember at the start we talked about the coloured badges, coloured bits on your badges? Please don't forget that. There are teas and coffees available, I think, is that right? Are there teas and coffees available? No one's nodding, I'm not sure. Not sure. But do talk to each other, choose to talk to people on the post. Also, if you haven't yet, please do go to the Create Communities platform, which is you can find via the Restitch website or via the QR badge on the back of your badge. And we've had so far, which is actually about 20 minutes ago, 63 responses. We're going to be making a small publication about the bits of London that you, the attendees, find helpful to your lives or perhaps threatening to your life. Places big or small, grand town squares, public parks, shopping centres or market stalls, whatever has the potential to connect us. So we're asking you to place points on the map. Just realising I'm not by the microphone, I should do that, shouldn't I? To answer this question, how well, I'm very experienced in doing this sort of thing, so I don't make these sorts of basic rookie errors, don't you worry. How well, we asked you to place points on the map to answer the questions, how well does this place work for communities? Here is the map. I'm not sure if George can respond in real time, but if you can zoom in a bit and then show some of the responses and perhaps go down into Google Street View, George. I don't know if it is happening, brilliant. There we are, look, there's Elephant and Castle is one of the themes I think that has come out. Traffic, the roundabout at Elephant and Castle has not come out very well. That's not showing any of the... he's just zipping in there, and you can go into Street View, and you can then go back into the map to place your response, and it is... Hang on, it's green for places that work for you and for your community or your neighbourhood or people you know, amber for places that could be improved, please do suggest how, and red dots for places that don't work for communities. Themes coming through so far, strong preference for green and enclosed spaces, Regent's Park, Battersea, but not always, Shepherd's Bush, green not liked, pedestrian areas like Shepherd Market in Piccadilly and Chiswick Market, places with a good view over water, and that correlates well with the value data, and as I say, places like Elephant and Castle, also Oxford Street and Nine Elms having the greatest concentration of negative comments. Thank you, that's it. I apologise for the slight error with the microphone, and we will restart with the great Danny Kruger chairing the next session at 10 to 4. Thank you very much.